learning about the ankle joint. And here I'll be explaining with the help of the animation and images the ankle joint, the subtalar joint complex, and clinical association of different injuries which are related to these joints. And in the end part, I will be using a model. There I'll be showing you the different muscles which are responsible for bringing different actions at my ankle joint as well as my subtalar joint complex.
Dear viewers, today we'll be learning about the ankle joint. Ankle joint is a very strong weight bearing joint of my lower limb. If we classify this joint is a hinge type of synovial joint. And the movements which occurs at these joints are plantar flexion and dorsiflexion. Let's look at this image, and where you are looking at the three pictures of the same person, and this is the neutral position. The foot is on the surface, and when the foot is being lifted, this position is which is shown by this arrow which is going upwards, that is my dorsiflexion. And when this foot is going downwards towards the surface, that is my plantar flexion. So these are my dorsiflexion and the plantar flexion movements which are occurring at my ankle joint. So to understand this joint, these are the bones who are articulating with each other. As we said, this is a synovial joint and hinge type. And these articulating surfaces, what are these? The upper surface of my talus bone, and we can see that this is contributed medially by the lower part of my tibia and laterally by my lower part of my fibula bone. And these processes which are projecting downwards, these are the malleoli of my tibia and the fibula. And this pattern is given a name of mortise. And this mortise is, you can see this cube and it fits in very nicely. That makes it a very stable joint. And there you can see the fibula and tibia, and these are the lateral and medial malleolus of my tibia and fibula both. And there is the talus. And these two bones are connected by interosseous membrane. Now let's look at this foot. And there you can see this is the medial side of my left foot, and you are looking at the tibia. Fibula is not visible in this view. And you can see this is the malleolus, the medial malleolus of my tibia. There is the talus, calcaneum, navicular, and then my cuneiforms, and they are 3 in number, and then we can see the metatarsals. So now let's look at the ligaments. The ligaments of any hinge type joint in our human body, these are collateral ligaments. Same is the case here. We have the lateral collateral and the medial collateral ligament. So let's try to bring those ligaments here. So you can see this number 1, which is shown with this blue color, that is located posteriorly between my malleolus of my tibia towards my talus bone. So we call it posterior tibio-talar ligament. And then this is my tibio-calcaneal, from my tibia going towards my calcaneum. So this is the tibio-calcaneal part of my medial collateral ligament, and there you can see another slip which is extending from my tibia towards my navicular bone. So we will be calling this one as tibio-navicular part of my tibial collateral ligament, and then this one which is going anteriorly from the tibia towards the talus, and we call it anterior tibio-talar ligament. So now we have seen the anterior tibio-talar ligament. So these 4 slips, these 4 segments of my tibial collateral ligament are the one who are present on the medial side, and this is also called as the medial collateral ligament. And collectively, this ligament has another name, and we also call it deltoid ligament. So simply the deltoid ligament, tibial collateral ligament or medial collateral ligament has 4 components, and these are arranged anteriorly and posteriorly between tibia and the talus, between the tibia and the navicular bone, between the tibia and the calcaneal bone. And together they are called the deltoid ligament, and that is because of the shape of this ligament. Now let's look at the lateral view of the same left foot, and let's see what are the ligaments which has been present in my lateral collateral ligament. So we can see that there's a ligament which extends, there's a slip of this ligament which extends from my fibula towards my talus, and this is going anteriorly, so we call it anterior talo-fibular ligament. And you are looking at the posterior talo-fibular ligament, and then from my fibula towards my calcaneum, so that is my calcaneofibular ligament. So now we have seen there are two collateral ligaments. One of them are the medial and the other one are the lateral. So now what are the movements which are occurring at this joint? We have already talked about the movements which occur at these joints are the dorsiflexion and the plantar flexion. So the muscle responsible for producing dorsiflexion, there is a list of the muscles who are located in my anterior leg, and these muscles are tibialis anterior, extensor digitorum longus, extensor hallucis longus, and fibularis tertius muscle. So these are the muscles who are responsible for having dorsiflexion where at the ankle joint, and those muscles who are responsible for producing the plantar flexion, so these muscles are gastrocnemius and the soleus. These are the main muscle, and they are contributed by tibialis posterior, flexor hallucis longus, and flexor digitorum longus. So at my ankle joint we have dorsiflexion and the plantar flexion. Now there is another ligament which is connecting my lower tibia and fibula, and I can show you only the anterior component of that. So this is my anterior tibiofibular ligament. Posterior tibiofibular ligament is also there, but I cannot show you from this image. So now let's look at the same joint from the posterior view, and we are looking at the tibia and the fibula. The talus is being shown, and there is the calcaneus, and these are my malleoles. And then we are looking at the medial collateral ligament or the deltoid, the lateral collateral ligament, and then this ligament extends between the fibula and the talus, and we call it posterior talo-fibular ligament, and this one is my inferior tibiofibular ligament. Now, the second type of the joint which we can find in the ankle region, and that is my subtalar joint complex. What is this complex? You can see this talus bone has been lifted from the rest of the bones of my foot, and this is under my talus. This joint, this area is given the name of subtalar joint complex. And now let's talk about this subtalar joint. The subtalar joint is primarily a plain synovial joint, and the movements which are occurring at this joint are eversion and inversion. So now we can see that the talus has been removed, and you can see this once we remove that. So these are the location where this talus is being articulating, and these are the area. Look at the capsular organization of my subtalar joint, and there you can see this one is my capsular organization of my talo-calcaneonavicular joint, and this is my subtalar joint. Now this talo-calcaneonavicular joint, this is a complex ball and socket type of joint. You can see that this is formed here, and this joint, it also helps subtalar joint in bringing inversion and eversion. So the muscles who are responsible for giving us eversion and inversion, so these muscles are, we have for inversion we have tibialis anterior and tibialis posterior. These are the main inverters of my foot at subtalar joint complex, and my fibularis longus and brevis plus with tertius are the main everters for my subtalar joint complex. So now we can see that the location where we have the similar thing which we have talked about. These are my talar articulating facets, and these are my facet for talo-navicular joint formation. And this is the anterior articulation, and you can see this posterior articulation site. Now the movements we have talked about, let's look at again. This is my inversion and this is my eversion. Now the injuries occurring at the ankle joint, we all know when we are walking, we are vulnerable to have these type of injuries, and ankle joint is the most frequently injured joint during the normal activities and the sports related injuries. And they are mostly the position where we can have more instability is the time when our foot is plantar flex in its position. So there is a less engagement, and this is due to the shape of my talus bone. So let's look at the anterior talofibular ligament sprain or tear. It's a most commonly occurring injury. And the joint, now we can see that we are looking at the lateral view, and we are good with the name of these joints. We have already talked about it. This is anterior, posterior, and this is from my fibula towards the calcaneum. So now the most commonly occur is this my anterior talofibular ligament. Others are also damaged, and then once this goes, if this is damaged, what is this? Anterior tibiofibular ligament. This is my anterior talofibular ligament. This is my grade 1, and then grade 2 and grade 3. This is how we can grade these injuries. And usually what happens, these injuries are occurring, what's the time? Once we have hypereversion. As a result of hypereversion injury, and who are the people who are more susceptible for this hypereversion? Surface, and along with that, those who are wearing high heeled shoes are more particular prone to this type of injury, because their foot is perpetually plantar flex in the high heels and is most unstable and more vulnerable for this type of inversion type of injury. And this sprain, this tear can occur, and we can see that once this is happening, you can notice there's a tear which is occurring at my anterior talofibular ligament. And the symptoms are, this is being followed by severe pain and the swelling, and this is where at the anterior medial aspect of the ankle joint, and maximally where we can find it over the anterior talofibular ligament. So this is a very common ankle sprain, and the best thing is apply ice, pain relief, and the rest. That's the best treatment unless you have some more major type of injuries. Now let's go forward. We know we are looking at the posterior view of my ankle joint, and now what is happening? Look at it. There is a displacement of my calcaneus and the talus laterally during hypereversion tear, and then you can see that the tears are coming. First, medial ligament is being damaged, medial collateral. So this is a ligamentous injury. So by this empty arrow, I am showing the injuries which are occurring to the ligaments. So this is a ligamentous tear. And then we can see the malleolus of my tibia can also be fractured. And this is a fracture here, and the fragment goes separate. And then we can have a fracture where at the distal fibula near to the malleolus, and then the malleolus is being separated. So this is a fracture, and when it happens, once we have displacement of the calcaneus and the talus laterally, where, when, during hypereversion tears. Are we good so far? So classically, this type of pattern, once we have these injuries, these fractures, the ligaments are gone, bones have been fractured, this is famous with the name of Pott's fracture. And what we see here, the displacement of the calcaneus and talus laterally during this hypereversion type of event. Now, let's review the ligaments of my ankle joint with the help of this model. You can see there are so many ligaments which has been shown on this model, and there are some muscle tendons which are also visible here, but I'll be only targeting the ligaments which are connected to my ankle joint only. So this one, what is this red band that is extending from where? First of all, we should establish which foot is this. This is my right foot, and you're looking at medial view. This is the medial view of my right foot. And then this is my anterior tibio-talar ligament, and this is my, going backwards, this is my posterior tibio-talar ligament. Then we can see part of it's going towards my navicular bone, so we call it tibio-navicular ligament, and this one from the tibia towards my calcaneum, and that is my tibio-calcaneal ligament. So these ligaments are very clearly visible on this given model. What we can see here, an anteriorly placed, we just talk about it. This ligament is my anterior talofibular ligament. There we can see the posterior talofibular ligament, and this one is my inferiorly located between the fibula and the calcaneum. So this is my calcaneofibular ligament. And these are my lateral collateral ligaments.
Okay, let's look at the muscles who are responsible for bringing dorsiflexion at my ankle joint. Let me start medially. Before that, we need to orient it on this model. This is, you're looking at the model of left foot with the ankle and the lower leg. They are being shown. And this is my first toe. And there we can see the muscle which is being visible here, that which is passing under these bands. These are my extensor retinaculi, and this muscle which is coming all the way and going in the sole of my foot, this is my tibialis anterior muscle. After that, you can see another muscle which is partially visible here, but at the bottom it's very clear, and then it's going towards my distal phalanx of my first digit, towards my big toe, and that is my extensor hallucis longus. And then you can see these four slips, and they are coming from this muscle, and this is my extensor digitorum longus muscle. To see the fibularis tertius muscle, we have to move this model little bit. And now you can see very clearly this slip. Can you see this separately going slip? This is the slip of my fibularis tertius muscle. Now let's look at the group of muscles who are responsible for bringing the plantar flexion at my ankle joint. And there you can see the gastrocnemius, which is not nicely shown here, but the soleus is very nicely visible. And together they are making this talo-calcaneus. And then these two muscles are assisted by my muscle, which is my tibialis posterior. You can see that it's going and getting attached here. And then we have the muscle, which is my flexor hallucis longus, and flexor digitorum longus is not clearly visible on this view. So these are the muscles which are responsible for having plantar flexion at my ankle joint. There I can show you the muscles who are responsible for bringing eversion. These are the everters. They are located laterally, and you are looking at the fibularis brevis and then the fibularis tertius. Fibularis brevis is just attached at the base of my fifth digit, but if you have to look into this fibularis longus, you can see that it's going all the way in the sole of the foot, and look at its journey, and it's going all the way towards my first digit, and it's attached just next to the attachment of my tibialis anterior muscle. So you can see that this muscle makes a sling underneath in the sole of my foot. So these are the two muscles who are responsible for eversion. And for inversion we have these muscles. This is my tibialis anterior and this is my tibialis posterior. Tibialis anterior and tibialis posterior are the muscles who are responsible for inversion at my subtalar joint complex, and my fibularis longus and brevis are the muscles who are everter of my subtalar joint complex. And you can see this fibularis longus, it's going all the way and is attached just next to the attachment of my tibialis anterior. And look at the fibularis brevis, that is just going to the base of my fifth digit.